So testing is really the one activity that we can do from a community perspective that does provide us the ability to keep a pulse on what's happening with community transmission. So we know from 100 years of surveillance that whatever gets reported to public health really is only the tip of the iceberg. We know that when we are monitoring things like testing, that it is really just one indicator of what's happening with the disease and the transmission at the community level. So there's a lot of things that have to happen for that information to reach the health department. First of all, somebody has to be sick enough to go to the doctor. So we know that there are very mild conditions where people might have a little bit of a tickle in their throat, but they're not going to go to the doctor, or they're not going to get bothered by going and getting a test if they're really not significantly ill. And so those individuals, though, could still be a source of community transmission for COVID, and we're never going to know about them. The other thing that needs to happen is once somebody goes to the doctor has to test them. And if the doctor clinically diagnoses that individual, but they don't ever test them, we will not get a trigger to receive a report at public health. So the third thing that needs to happen is once that test actually is conducted, the test result has to get reported. So even though there are rules and laws around providers and laboratories reporting those positives, it doesn't always happen. There are small enough providers, private practices, for example, that sometimes it's not part of their practice and they don't have the education behind what reporting rules look like. And so we don't receive that report. And so there's already 3 scenarios where there are people that are ill that public health is never going to find out about. And so we know from a data perspective that the people that we are actually getting an opportunity to talk to are just a subset of the individuals that might actually be a part of that community transmission picture. So the second part of testing is the ability for public health to conduct really the only mitigation measures that we have available to us for control of the infections. And so that would be things like recommending isolation for those patients and recommending quarantine for their household contacts and their other close contacts. Those are really the only tools that we have outside of masking to help curb the transmission. And so we definitely recommend testing for anyone who is symptomatic. We obviously, people who are concerned about that asymptomatic infection status. We do know that asymptomatic infections, they are a source of community transmission, but if somebody is asymptomatic, they're infectious at a lower rate than somebody who is exhibiting symptoms. And so in public health, we always have to be extremely resourceful and get the biggest bang for our buck for the funding that we actually do have. And so we are focusing on symptomatic testing for that reason. But yes, for individuals who have symptoms, we recommend testing so that it can set off that chain reaction or that domino effect, so public health can work with the community to implement those control measures.